Welcome. Thank you so much for coming. My name's Thomas. I am VP of Sales and Marketing, or you can call it growth at Snuggle Bugz. So that means I'm responsible for anything you see. So if you really liked it, you're welcome. And if you didn't, blame my team. And it's fine, right? We at Snuggle Bugz believe that first and foremost, our job is to not sell shit, but first and foremost to educate and to instill confidence in each and every one of you so that you can make the right choice for your family. Everything we do is about focused on navigating the early stages of parenthood, making sure that you feel confident and that you're ready to face what is the biggest life change. And so we love events like this. We like the more than big sales events because it gives us an opportunity to bring forth something new and unique. We're partnering with a great organization, The Womb, and to give you hopefully an edge up in life and the ability to feel ready for this next big stage. So we're thrilled that you're here. Thank you so much for coming. And while we're obviously going to try to provide the best content possible, it's all possible because of your willingness to partner with us. So thank you. This is exciting and we're thrilled to do this. We had one in March and we have another coming up in May. So if you missed the one in March, we're going to post it on YouTube this week. Next week. And if you want to go back and see some of that content, it was all about preparing to push. It's probably for the gents, like a little more female centric, I would say, for that specific one. So you don't necessarily need to watch, but it is fantastic content. And we have another one coming later in May. So check it out. We'd love to see you again. My job is to introduce our speaker for the evening, the wonderful, magnificent Dr. Janvier. I was going to call her Doc G, and I wasn't sure if that was appropriate, but yeah, cool. Who is going to come and lead through? She is from an amazing organization called The Womb. My wife and I actually took a course at The Womb like about 6 weeks before our first little guy came, and it was fantastic. We highly recommend the organization. Make sure you go and talk to them, check out all that they have to offer. It's a fantastic place. I wish we remembered more of it in the moment because we only did one session. So I would say you want to partner with them so that you remember more and are able to benefit as much as we did. But I will welcome up our speaker. If you don't mind putting hands together, I want like loud claps, not golf claps. Thank you so much.
And Dr. G works. That's often what I'm known as around the womb. Just out of curiosity, how many people have heard of the womb? Okay, it's almost half, at least a quarter. I am one of 3 naturopathic doctors at the womb, and I have been there now for 3 years, and I've been practicing for 5. So a big chunk of my career and practice has been focused at the womb. So I'm very honored to be here today. Next slide, if you could, Chris. At the womb, similar to the other practitioners, I specialize in all things women's health, fertility, hormones, as well as pediatrics. Fun fact about myself, I am 6 months postpartum myself. I gave birth to my daughter in October 2024. So I am fresh off the press with lots of what you guys are going through. And I can tell you, studying it in a textbook is one thing, and living it and experiencing it myself is another. So I'm thrilled to talk to you about it today, and I feel like I can apply a lot more of my personal experience now to this topic. So next slide, we'll get started. Just an outline of what we're going to talk about. I'm going to give you the naturopathic perspective, the approach to preparing for labor and optimizing hormones, like what that means, optimizing hormones for labor, but also postpartum and lactation. Specifically, we're going to look at how the role of blood work, supplements, nutritional like guidance, counseling, herbal medicine, and acupuncture play a role in optimizing these hormones. We're also going to look at lactation, specifically the ins and outs and setting yourself up for success. Breastfeeding is a full-time job, and there's never too much you can learn and prep for in advance for that endeavor. So we'll spend some time there, and we're going to end off with timing of naturopathic appointments and why they matter. So a lot of people, want to come see a naturopath. They're not sure when, and I will, give you a guideline of when you should book in with your appointments. You could take a picture of it at the end, just so you can make the most out of the appointments. And if you're using private insurance, those benefits, just to make sure that you're using those wisely. And then just a few helpful resources that I'll discuss to also help you, to understand what options there are at the womb in addition to seeing somebody like myself. Next slide, please. So preparation starts here. So the minute you get that positive test, whether, I don't know what your preconception journey looked like. For some, a lot of these things start then, their fertility journey, but the real work in prepping your body for labor and lactation starts with that positive test. Once it's brought to your awareness, you're able to start your journey of taking care of yourself and putting those things in place and being prepared. The more prepared you are, the easier, the smoother your experience will be with labor and lactation. I strongly believe that, education builds confidence, and confidence builds power, not just for moms or the one carrying baby, but also for husbands. And I'm so glad to actually see partners here. I wasn't sure the turnout that we'd get tonight between the 5th round of the playoffs tonight and the weather. So I'm going to try and make this efficient for you, and we're going to stay on time, so maybe you can catch the 2nd or 3rd quarter. But it's wonderful to see both parties involved. Next slide. So we'll start with the basics. So blood work. So naturopathic doctors can requisition blood work. So these are some of the things that I commonly test. You might be wondering, well, Dr. G, when I, become pregnant, I go see my family doctor, or I book in with a midwife. Those are actually some of the top things people say, and that comes to their mind when they get a positive pregnancy test is, okay, I got to call my doctor or midwife if I know I want a midwife, because there could be a wait list. And I guess the third thing I hear is get on a daycare list. The waits can be crazy. So my goal is to also have people register, okay, maybe I should reach out to my healthcare team. Who's this going to involve? My naturopath, my osteopath, my chiropractor. Who do I need to let know that I'm embarking on this journey? So I recommend blood work for anybody who comes to see me to test for things that your family doctor or midwife might not be looking for, especially if you haven't had blood work done in a while leading up to that point. So some of the things you can see here, like iron levels, iron stores, B vitamins, vitamin D, TSH, T3, T4, those are your thyroid hormones, play a very, very important role in your pregnancy, especially in that first trimester. And a lot of women don't know what their thyroid status is at when they become pregnant. Blood sugars, including insulin. Lots of people, healthy, young, why would blood sugars be an issue? It's, important to understand where you're starting from, so then you can monitor as you go through pregnancy, and monitor for things like just potential for gestational diabetes. Are there risk factors, those types of things, and start preventing now. And prolactin, that lovely little hormone that is responsible primarily for milk production and lactation, can also be screened early on. Some women are aware of their prolactin based on their fertility journey. It might have been something they've tested already, but a lot of people haven't had that tested. So you can get a lot of insight in that first appointment and that first set of blood work. Okay, so I thought I would talk a little bit about basic supplements. So this is a big question that NDs get. What supplements should I take? When should I take them? Are these ones good? All of those questions can be answered in a naturopathic appointment. Everybody that comes to see me who's pregnant, I basically give them like the core supplement pack. Like, it's okay, we're gonna be on a good prenatal with the right doses, a reputable one, vitamin D, omega-3s, iron, give or take, depending on your levels, calcium, magnesium, and a probiotic. So those are the supplements that majority of people who come to see me are going to be put on. Actually, if you could go back for a second. With that being said, these basic supplements do vary from person to person. So it's important to know, what your friend is on might not be, the best version of that supplement for you. So I have a lot of people on stuff, and, I ask, what made you go on this prenatal, or what made you pick this omega-3? And it was usually like, my girlfriend was on this one and she said she liked it. So not that there's anything wrong with that. I think it's good to be proactive and keep your ears open, but there are differences in supplements with quality and dosages that are really important and can be tailored specifically to you. So I just wanted to touch base on that. And also going through supplement lists and getting rid of things that you might necessarily not need to take is also helpful. There's such things, pill burden. You can get tired of taking a lot of supplements at once. So I'm there to guide you, come up with a nice supplement regime, and not waste your money and not waste your time on things that aren't actually helping. Okay. Herbs for pregnancy. The wonderful world of herbs, there are hundreds, thousands of herbs on the market. A lot of them are not researched in pregnancy and labor. And so it does make it difficult for the average person to go out and use herbs and decide, okay, which ones are going to be most helpful for labor preparation, and which ones should I take for my lactation? It can be very, very confusing. So these are some of the top ones that I often feel confident recommending and prescribing in my practice. They all work in different ways. I'll go through a few of them. I won't go in extensive detail, but just so you can have some idea. Ginger is one that you can work with throughout your entire pregnancy. So as when we're pregnant, women, HCG hormone levels go up, and that can cause nausea and vomiting for some women, not all. And ginger can be a wonderful tool to have in the cabinet at home to help offset that hormone increase. But it also can be beneficial at the labor stage where changes in that hormone happen again, and you can have nausea-induced labor. Some women, again, experience it. Other women do not. How would you ingest one? Good question. Good question. So herbs, I'm glad you asked that. Herbs can actually come in like 3-4 forms. They can come in teas, which most people are familiar with. They can come in like powders or like capsulized powder. And they can come in tinctures. So is anybody familiar with that word, tinctures? A couple. Most people are not. Tinctures are just essentially a very strong extract of the herb in a liquid. So it's extracted for the most part in ethanol or glycerin. And it allows for a very strong, high therapeutic dose of the herb. So it's actually a very effective way to take the herb. You can get tinctures at most health food stores. They're very easy, just as easy to get a hold of a tincture as it is a capsule. So when I'm recommending these herbs, it's often in tincture form. So I'll keep moving along. So ginger's a good one. Red raspberry leaf tea. There's a lot of buzz around that one. That one I usually recommend 36 weeks plus, some people 34 weeks if there's no contraindications, but it's considered a uterine tonic. So uterine tonics are herbs that are meant to help prepare the uterus for labor. They work by tonifying the muscle, bringing blood flow, stimulate blood flow to the uterus, effectively or hoping to effectively increase your contractions. So it's a good one to start ahead of time. It's also very nutritive. So it's got vitamin C. It can be very replenishing for moms prepping for labor, as well as nettle, that second one there. It's also a very nourishing herb. I recommend that in women who have lower depleted levels of vitamins. So iron specifically, vitamin C again, maybe you're getting a lot of colds and flus while pregnant. Nettle is a wonderful one to have in the cupboard. Lemon balm and lavender and chamomile, they all kind of fall in a similar family. They are anxiolytic, so they can help with anxiety, stress. Cortisol levels tend to go up later in the third trimester. And so, who can't benefit from a little bit of nervous system support at that point in time? And I think the more you can support your nervous system leading up to labor, the more your body will be able to get into the groove of all those fun, relaxing hormones like oxytocin and the prostaglandins, like the pain relief hormones. So lemon balm, lavender, chamomile, those are nice. Those ones are nice in a tea, actually. But again, tincture is a little bit stronger if it was a more severe case of anxiety. Catnip, and I'll skip the next one, skull cap. Those two are actually, I use those in tincture form for pain management during labor. So as we're going through all stages of labor, women can dose with those herbs as a natural pain solution. You can also ask your midwives about some of these herbs. They tend to be well-versed in some of them. Another one they tend to be quite well-versed in is cramp bark. That is also, just as it sounds, used to ease uterine cramps during active labor, but also postpartum. So some women, or that postpartum hemorrhage after birth phase, where the cramping can continue. So that's a nice one. I really like the cramp bark. The last two, Make It Pop, that's a name of an herbal blend. So sometimes you'll find tinctures that have a bunch of herbs in it, like a nice combination of all of the above. Make It Pop is a combination of herbs that actually do impact labor hormones. It has things in it like black cohosh, blue cohosh. You might have heard those herbs before. And it's got a few others. It's actually meant to stimulate contractions. So that one I use in women who are, again, 36 plus weeks, looking to, you might have an induction date, you're looking to avoid induction, or just assist the process of labor naturally. So it's a good one. Not everybody qualifies for it, but it is there, and I use it quite frequently. And then the last one, shepherd's purse. Shepherd's purse is, what's the name for it? Helps with postpartum hemorrhaging. So it's not meant to be a substitute for medical interventions, if there is a severe postpartum hemorrhage, but it can be an adjunct therapy to, the oxytocin shot they might give you. Some midwives actually carry it with them in a tincture, just to help slow the bleeding down. Some women like to use it a week after postpartum to manage that bleeding as well. So those are some of my favorite herbs. The quality of the herbs definitely matters as well. So going to, a Healthy Planet or a Goodness Me or Nature's Emporium, those level of stores are quite, I can, with confidence, recommend picking up tinctures from there, no problem. But there's also separate companies that I order through privately, some in Toronto. There's other Canadian companies that I really, really like. So yeah, so it's a little bit about the herbs. You can shimmy on over. Let's talk a bit about milk. So those were herbs that are more involved with like pregnancy and labor. Galactagogues are what the herbs that support milk production and milk letdown. That's the name of that type of herb. And there's a lot of hype around, finding the perfect herb for milk production or the magic pill that's going to make my milk come in. And it really should not be the first line. I always educate my patients, the first line of therapy for low milk supply. There really needs to be like a medical evaluation early on in the breastfeeding journey as to why the milk supply might be low. So that usually involves like doing some blood work, checking on the thyroid, or checking, asking mom about stress levels. There's a lot of things that can impact milk supply that an herb simply won't fix. And so it's important to do that first and foremost, as well as see the specialists, the people that do this for a living, our lactation consultants. We have some wonderful lactation consultants at the womb, and it's important for them to assess the frequency of the milk removal, but also the effectiveness of the milk removal. So lactation consultants can do weighted feeds, where you actually can get that like objective data, which is really cool, about how much baby's transferring. And are there issues with tongue tie? Are there issues with the latch and positioning with mom? So those things can be troubleshooted rather quickly at the beginning, before you need to dabble into buying this herb and taking this supplement and those things. But with that said, if you are going to venture into the world of herbs and everything's been ruled out and there's no red flags, and you're just simply looking for a little bit of a boost and support with your milk supply, these are some of the most researched herbs that I have found. So we've got fenugreek there, we have fennel, coleus, that's supposed to be one word, coleus ambonicus, palm date, ginger, and moringa. So you can purchase any of these herbs in tinctures individually, or a lot of companies will do like a nice blend of fennel and fenugreek, moringa. So those are just some names to look out for on those blends if you are looking to boost your supply a little bit. It's a question.
Is eating foods that are high in this still, is it just not enough?
Correct. Usually. Yep. There's no harm in like dates, like palm date, for example, is actually like the palm, the roots of the palm that they turn into a powder. Dates also have some effect on milk production, but you'd have to eat like 100 dates and your blood sugars would be through the roof. So it's usually about concentration. That's a good question. We're good on that. This is just a little service announcement. Package inserts, often very not helpful. I'm sure everybody at some point has turned their supplement over and seen, if breastfeeding or pregnant, do not use or consult with your healthcare provider before taking. And that really comes down to legalities. So I think that intimidates a lot of women who are trying to take care of their health and look for alternatives in their pregnancy. But really what that is the companies just owning the responsibility on the practitioner. So they're just transferring that responsibility to go to somebody who knows your health history, knows more about you, who can make this decision. Because if you grow a third toe, we don't want to be the ones that you're calling. So overall, most herbs, there is a very large therapeutic window. Most people can take them. A lot of them are, have not been shown to be harmful in pregnancy and labor. But there definitely is a screening process that I go through when picking which herbs may benefit you and can be helpful or could be harmful. Okay, let's talk a little bit about physical modalities. This is one of my favorite modalities that naturopaths lean into, and that's the use of acupuncture for the purposes of labor preparation. So you often will hear labor induction acupuncture as the term. I prefer labor preparation because you can start it at 36 weeks. In my 5 years of doing this, I've never had any clients go into labor on the acupuncture table. It's rather a process over a series of appointments, so maybe 2 or 3 visits within a week or two, 36 weeks plus, to get those labor hormones going. And so I often get asked, well, how does this work? Like, how does inserting tiny little needles in these points, induce labor? And there is science behind it. Essentially, it comes down to the nervous system and the ignition of the acupuncture needles in the skin, releasing endorphins for one, which lowers stress levels, lowers cortisol levels. Everybody does better when they're not stressed. But it also signals neural pathways to the brain to release things like prostaglandins, which are pain mediators, and oxytocin as well from the brain. So when those hormones start to get going, that's when we see contractions. That's when we see cervical ripening and the early signs of labor. So the appointments are usually about 30 minutes. The first one's longer. Women come in and they, go through all the questions they have about acupuncture. I answer them, and then it's just your time to relax. So it can be a really nice adjunct therapy when you're prepping for labor. So I've put a little bit of an intermission here. I don't know how are we doing for time? We're good? Do we have time for questions? Okay. Yeah. Is there any questions thus far about any of those things that I've talked about? Oh, we've got one right here. So her question was, are there any of these herbs that you shouldn't take with gestational diabetes? And if you're able to go back to that slide, the answer is yes. Out of these herbs here, in preparation for labor and pregnancy, these ones are okay. These ones listed here. It's the ones that are in the other slide for the lactation. So these ones, even if, so your, gestational diabetes is primarily a condition of pregnancy. Your sugars are still trying to resolve itself in that postpartum period. But if I had a client come to me who had gestational diabetes during pregnancy and wanted herbs for milk supply, fenugreek would be one I'd be very cautious of. And that's just because some research has shown influence in manipulating sugars, as well as the palm date. So again, just the natural sugars that come from that plant, I would be cautious with that one as well. Good question. So if somebody had hypothyroidism or Hashimoto's, which of these herbs would you not recommend? And the answer to that is none of those. Most herbs with thyroid are safe. The only one, so these ones are fine. The one on this side here, lemon balm would be one. Lemon balm is used, actually, another use of lemon balm is for hyperthyroidism. So it can actually cause the thyroid to underfunction. So if you are somebody who has already an underfunctioning thyroid, we're not going to work with lemon balm, or we'll work with lemon or lavender or chamomile for that same concern. But all the other ones on that list are good. That would be those top 3: ginger, raspberry, and nettle. I would say they're the safest. They are the most beneficial for all of the pregnancy symptoms, and they're very nourishing. So anything that's going to give you extra nutrients during this time is helpful. Anybody else? Okay. Yeah, I think we'll take a little break. Pee break if anyone needs it. Have some water, and then when we resume, we're gonna kind of dabble into a little bit more about the physical modalities that naturopathic medicine has to offer with the acupuncture. Okay. Okay, everybody have a good stretch there. Little break. We will we'll pick up continuing with some acupuncture discussions. Has anyone heard of auricular acupuncture? So auricular acupuncture is using acupuncture, but to a specific location, and as you can see in the picture there, the ear, specific to the ear. So it's actually a very intricate component of acupuncture. There's about 200 points in the ear, all reference to different parts of the body and organs. So there's very, very tiny needles that we use to do auricular acupuncture. And they all have their own research and studies done for different components of labor and lactation. So I just wanted to discuss it with you because I think it's pretty cool. There's about 25 studies that have been done with acupuncture, auricular acupuncture, and lactation. The top points that often are used, there's about 6 points out of the 200 that they have focused on, those being the endocrine, liver, mammary gland, spleen, chest, and stomach. So those were the 6 main points used in these studies. And they've done it both ways. So they've done it where they actually use acupuncture needles over those points, but they've also done it with something called acupressure, which is where instead of needles, we use like a tiny little ear seed, kind of looks like a tiny little poppy seed that has an adhesive tape on the back over those points, and you can stimulate them yourself. Your practitioner can do it, but you can also do it at home, which is lovely. So once you know where the points are, you can continue the practice at home, and that's what a lot of these studies have done, just to increase the frequency and duration of the treatment. So these studies have mostly been done over about a week postpartum, starting in labor, actually. So they studied women who actively knew they were going into labor, had the ear seeds put in, started stimulating them as best they could during that time, but then continued it for about a week after. And some of the results were pretty good. So they found that women in the auricular therapy group lactated earlier than the control group. So the control group was just basically people who didn't do the acupuncture at all. So it was a very clear treatment and control group. So meaning they lactated earlier, meaning they had an earlier letdown of colostrum collection. They also ran serum prolactin levels on the women, and the women in the auricular acupuncture group had higher levels of circulating prolactin, which I think is quite significant. So overall, they concluded in the studies, the RCTs, that women who had received the auricular acupuncture had better lactation outcomes overall. And so there may be a role for this in treating low milk supply when initiated early. The problem with these therapies is that, and then the research is it's not continued. They're working on studying postpartum a lot more, and what does this look like in 3 months? Like, if I keep doing this, is this going to have the same effect, or is it just at the beginning? So those answers are still in its infancy, but I work with what's out there, and if there's little things you can do or be educated on going into labor and postpartum with lactation, this is one of the things you can do. So again, you can do it with the regular needles, or you can do it with the seeds, the ear seeds. So this is just a continuation. I don't know if you can see that image of the woman there, but these are distal points. So these points, again, you can do with traditional acupuncture or with acupressure. These points have been studied to activate the milk ejection reflex, so the letdown of milk for those women who are struggling with letdown. And it's also been studied in women in all types of births, so cesarean, vaginal, preterm births, and they know they can rely on those 3 points. CV17, which is just right above the belly button and below the sternum. Stomach 18, which is just below the breast. And then small intestine 1, which is actually just on the pinky corner of your pinky nail. So it seems a little bit crazy. All these points are in different spots, but they follow the meridians of traditional Chinese medicine. And they've used them in numerous studies, and those are the top 3 points that they have used for supporting lactation. So I often have a lot of clients come in, they want to try it. I educate them on which points, how to stimulate them, let them, have access to the ear seeds, and then you can do it at home yourself to, I think the more repetition, we do know frequency of and duration of treatment has better outcomes. The no-brainer hormone, oxytocin, the love hormone, the cuddle hormone. This is something that everybody has access to, and something that partners can actually really help with. Oxytocin is, again, one of the most important hormones in labor, in the progression of labor, your contractions, whether labor stalls, whether labor progresses. Oxytocin is also the artificial hormone that they'll use to induce labor. So if we can naturally get things going, it will benefit you all the way through into postpartum as well. So oxytocin can be boosted through, hugs, cuddles, those foot massages, partners, and of course that skin to skin that everybody talks about and that we know more about now, how essential it is for mom and baby, particularly in that postpartum. Yes.
Is there a difference between mom and dad interactions in excretion of oxytocin and output? Or is it the same for both?
In terms,
Mom and dad with the baby.
oh, with baby. So in terms of like for baby will get the benefits of the oxytocin from both. So if dad does skin on skin, mom does skin on skin, baby is going to have the benefit of regulating like their blood sugars, their breath. Amazing things can be done with skin on skin, and that can be offered from both mom and dad. For the milk production, of course, having baby skin to skin with mom is beneficial for mom's milk letdown and the initiating of the breastfeeding. Next. Okay, nutrition. So this is another area that I often dabble into with clients. Nutrition, I think, is often very underestimated in terms of the power it has in preparing women for labor and how it helps balance those hormones and, prepares you for that postpartum recovery. I always stress the importance of eating a whole food diet. Mediterranean diet, I would say, is the most researched diet for all things. Metabolic health, hair, skin, nails, but also pregnancy, like fertility, and preventing pregnancy-related conditions. So, avoiding irrational dietary patterns during pregnancy and postpartum is something that I discuss with women, especially when they're trying to focus on losing weight postpartum. And I completely understand that desire to, bounce back and feel like yourself again. But at the end of the day, a happy mom is a fed mom. Happy baby's a fed mom. So it's really about getting enough calories, sometimes not even as much as what calories you're getting. It's just making sure you're getting enough food, and not limiting yourself in that period of time, because it's the food is the building blocks for your hormones. So we're preventing deficiencies, keeping iron levels up, keeping calcium, magnesium up. Very, very important for your milk production, and for even like postpartum happy hormones, serotonin, dopamine, and preventing things like postpartum anxiety and depression. So we'll talk a little bit more about the specifics of nutrition in the next slide here. So I just posted this chart. You can find this online. But this was published in the American Journal of Obstetrics and Pediatrics. And basically, it breaks down the key nutrients that is different for women during pregnancy, the nutrients that you probably need a little bit more of, and then it gives the justification for breastfeeding on that far side. So I just want to highlight like two really important ones with breastfeeding, and that would be calcium. So the recommendation is about 1,000 milligrams a day. This can be hard for some women depending on the type of diet they eat. I find nowadays there's a lot of women not consuming a lot of dairy, mostly gut issues, skin, lactose intolerance, but also just, dairy and some of the things that are associated with dairy, they try to limit it. So calcium deficiencies I'm seeing more of. And so calcium plays, a big role in milk production and supply. So a lot of my clients will supplement with calcium. There usually is a decent amount in prenatals, but it usually won't hit that 1,000 milligrams just with the prenatal alone. So calcium is one I like to highlight, and then vitamin D. So prenatals have vitamin D as well. And the recommendation is 400 units a day. So you usually do get that from the prenatal. Usually there's like 400 to 1,000 units in a good prenatal. But I would say taking a little bit of extra vitamin D couldn't hurt, in addition to that. I find a lot of people, just based on where we live, a lot of deficiency. Most people that I test for vitamin D are low. So there's a big wiggle room in how much vitamin D you can take. So those are probably two of the most important. And the other vitamins there, I would say it's very dependent on you as an individual, whether or not I'd recommend extra. But those are the recommendations and the dose. And you can kind of go through and say, okay, do I get this much in a day? Is there, or looking at your prenatal, is there this much in it? And you can kind of check it off. So that's just a little cheat sheet for you. This is just another way to look at it. So some people like to talk in like macros, and or like the food group. So in general, women are, could have an extra of 300 to 500 calories a day postpartum to support the demands of breastfeeding and those hormones. So what that looks like, it translates into, for fiber, maybe about 29 grams a day. So that's an extra 4 grams than baseline for women who are not breastfeeding. 3.8 liters of water. I know that sounds like a lot. It is a lot of water. And that's 1.5 liters more than what's recommended for the average person. When it comes to water, I always just say, drink water till the color of your pee is clear. You're getting enough, and listen to your thirst cues. Anyone who has already experienced breastfeeding knows what breastfeeding thirst feels like. And there won't be any way you will not be reaching for the water. So don't overstress about getting water in. You will get it in. Omega-3s. This is one that people can also be lacking in if they don't eat fish, or if you're vegetarian or vegan. So sometimes that does need to come through supplementation. There's algae forms as well if you don't want to take a fish-based omega. Protein, about 1.3 grams per kilogram of body weight. That's pretty standard across the board, even for non-pregnant women or breastfeeding women. But those are just some of the numbers if you're looking for that type of model of eating. And then breaking protein, fat, carbohydrates down. It's usually about 30% protein in your diet, 30% fat, 40% carbohydrates. And that breakdown to the T is very much like a Mediterranean diet. Like if you look at how they recommend you eat, that's generally what it looks like. And sources of protein, usually, they recommend lean sources of protein. So things like chicken, turkey, fish, healthy fats, avocados, nuts, seeds, and carbohydrates, those complex carbs. So those carbs that are higher in fiber, fruits and vegetables, brown rice, brown grains, those types of things. Avoiding those like very white or overly processed foods. And there's that little recommendation of calories. So of course your calories go up a little bit the farther out you are postpartum and breastfeeding, and that's just simply because baby's getting bigger and they're taking more from you. So your calories intake should also go up. Lactation cookies. I just threw this in here because I get asked all the time, what do you think about these cookies, Dr. G? Like, or is it worth it? And the truth is they're yummy, they're delicious, but that's where the buck stops. They don't have enough of the concentrated nutrients or galactagogues, again, that term to describe herbs that support milk production. They don't have a high enough dose in there to actually do anything for low milk supply. Just for reference, and this is based off of studies, not just my opinion, but there was an RCT, like a randomized controlled trial, looking at daily lactation cookie impact on milk production and breastfeeding at 1 month. So they basically took like exclusively breastfeeding or lactating mothers with infants that were 2 months old. Everyone was given a hospital grade pump, and then they were given like 30 cookies. The cookies contained oatmeal, brewer's yeast, flax seeds, and fenugreek. And then the control group had like conventional cookies with similar calories, so about that 57 grams worth, but there was no galactagogues in those cookies. So that was the control versus the study group. And essentially they found no difference in the group, in milk production, in the control or the lactation cookie group. So I do stay up to date on the research with cookies as well, and things that I get asked a lot of questions about. So I think recommending things like this to women who are in a vulnerable state postpartum and willing to try absolutely anything to feed their babies, I think it's doing a disservice and can lead to some false hope with things. So if you want to eat the cookies, they're good, but there's other ways we can boost that milk supply more effectively. Some other things I get asked about lactation hormones and production: water, beer, oatmeal. I'm sure everybody's at some point has heard, oh, drink the Guinness, have oatmeal every morning. So I like to debunk some of those things, when patients come to ask me these things, because there's no real good evidence at the end of the day to support these claims. And again, it's kind of feeding into that, like, throwing everything at the wall and potentially just leading to more frustration and upset for both parties involved. So what it's really about, as opposed to eating oatmeal every day or focusing all your attention on chugging water, it's really trying to have a well-balanced diet. As I talked about with the Mediterranean diet, my favorite diet ever. I recommend it for everybody, but it's just eating a well-balanced diet, eating enough food, drinking so that you feel your thirst is quenched. Nothing overly complicated, essentially. Let's see if there's anything else I have to say about that, but yeah, I think that's about it for that. Here is a breakdown for you guys of ND appointments or naturopathic appointments, what they might look like for somebody coming in, who's just found out they're pregnant. Early first trimester is usually where we'll do that blood work, that screening, looking for potential risk factors or hurdles that you might encounter through your pregnancy. We work with the blood work, build a supplement regime, and just talk about other practitioners too within the womb that I frequently refer to, whether it be the chiropractor or the pelvic floor physiotherapist. We kind of build your team and set you up for the next 9 months. Then I usually have a second visit in the late second trimester to go over. You've probably had your anatomy scan, you've had some more blood work done. This is usually where people have been screened for the gestational diabetes, maybe some hypertension has popped up, certain things. So that appointment can be beneficial for those individuals who need that extra touch point. Late third trimester would be the next one, 36 plus weeks. And that's where we would start to talk about, okay, let's optimize those labor preparation hormones. Let's talk a little bit, start getting in the habit of picturing what lactation and breastfeeding might look like if that's what you choose to do. We would do that in that 36 weeks plus visit. And then subsequent appointments, I always like to see somebody 4 to 6 weeks postpartum at the beginning. If you can get out of the house, wonderful. If you can't, virtual. But just that touch point, especially if you're not under close care. Midwives can be very wonderful for this reason. They come to your house in that period of time. But for people who have an OB, traditional OB, may not have those touch points early on. And if you're struggling with breastfeeding at that point in time, it's really crucial to get in and have that assessment. Like, is the thyroid giving you trouble? How are your stress levels doing? There's things we can look at. And then I'm kind of that gatekeeper for, maybe the lactation consultant. Maybe we need to have a visit at the pediatric dentist, assess for tongue tie, things like that. And then subsequent appointments are really on an as-need basis. So I find that's when I let my clients go and they're, engulfed with baby for the next, 3 months, getting through that 4th trimester. And then they tend to pop their heads in around 4 or 6 months when they're like, I'm ready to focus on me again. Baby's good. We've got the feeding under control. And now I want to feel better. I'm feeling really tired. My hair is starting to fall. Those things become more important now at that point in time. And that's when it opens the doors for a new assessment and some other things in there. So that's what your potential bookings could look like. And then the last piece, I just wanted to highlight some of the other resources we have at the womb particularly for lactation. So if you don't mind just going to that last slide for me. So the womb, we have certified lactation consultants there. They're wonderful. They often recommend having one lactation consultant appointment prenatally, so before baby's here, especially if it's baby number 1. But baby number 2 is fine too. It could be a totally different experience from baby number 1, but you could have an appointment prenatally, and then of course they're there postnatally need be. There's also, the womb has like an online infant feeding class that you can do from the comfort of your home. I think it's like an hour and a half. One of the lactation consultants just talks all things feeding and dives a little bit more into the hormone stuff I talked about and the nutrition with breastfeeding, positioning, different options for feeding, etc. There's also an infant or feeding cafe. So it's not just for breastfeeding moms, it's also for bottle feeding, just feeding your baby in general. And it's like a very safe space. It happens once a month where moms come in with baby. A lactation consultant will be there and she'll go around the circle and talk to you about how things are going. And if you have questions, you can get them answered, and that's free. So that's a really nice resource to look into. And then I put counseling services there because I think I had mentioned this once, breastfeeding can feel like a full-time job, and women put a lot of pressure on themselves to provide for baby, and counseling can be beneficial from that mental block perspective too. And if there's a lot of stress, that can impact your lactation journey as well. So I never like to discredit the therapy, even at that point in time early on. So those are some of the resources. I hope that this is helpful for you, and that you guys are able to take advantage of all the things that are available to you at this point. So that's it for me. I think we had some questions.
So if you have a question you'd like to ask Doc G, sorry about that, I didn't mean to wrap your feet around the cables. Please feel free to interject. I did take a couple questions in advance that we'd like to ask and just shoot out while we're here. So I hope that's cool and put you on the spot.
Absolutely.
Perfect. So number one, I feel weird. I'm like standing over
I know.
you.
Do you want me to stand up?
Sure, stand up. Keep
There
mobile.
we go. There we go.
There you go. So 0-0 still. Yeah.
Okay.
Yeah.
Like what?
So you mentioned protein. So
Yes.
one of the questions, I was just doing some quick math. That's basically like 100 to 120 grams, probably for the average person, maybe a little less for some. Some might find that difficult to get in their meals, depending on their diet. Protein powders, where do you sit on them? Is there some you recommend, do you not recommend, especially during pregnancy?
Absolutely. The 100 to 120 grams of protein can be overwhelming for sure. And that's the gold standard, but it's like as close as you can get to that, kudos to you.
Mm-hmm.
But protein powders can be a wonderful way to add that extra protein into your diet, especially if like vegan or vegetarian, if you're not eating meat. You can use a vegetarian-based protein that's like rice-based or protein or soy-based,
Mm-hmm.
and those are totally safe in pregnancy. Same with the animal-based protein. I always recommend asking your naturopath or a nutritionist which protein powders are, in their opinion, clean. There's a lot on the market that have a lot of extra stuff added into them, extra sugars too. Again, if you're looking out for that gestational picture or concerned about it, you want to be a little more careful about the added sugars in some of the protein powders. But a whey protein, I like whey isolate. I find it's a little more easily digestible. When you're pregnant, there's sometimes some indigestion that happens. And so getting, the whey isolate versus just a plain whey might be a little bit more gentle on your stomach.
Cool.
Yeah.
What about creatine during pregnancy?
That's a good question.
Okay.
Creatine during pregnancy. So I love creatine.
Mm-hmm.
I think it's an underused. So creatine, for those who don't know, is it's a pure source of protein. Mm-hmm. We have creatine in our bodies, in our muscles, and a lot of the culture around creatine is for bodybuilders or people who work out. But we're finding more and more in research that there's a place for it for that extra added protein just in general for people, for brain health, cognitive function, mental health, musculoskeletal issues, joint issues. So there's a lot of roles it can play.
Or even sleep improvements. I'm just thinking like post-pregnancy, lots of late nights, lack of sleep.
Yes. Pregnancy, I would have to look into studies. I actually am not sure if what that would look like in pregnancy. I, at the top of my head, don't see why it couldn't be consumed during pregnancy. Postpartum, most definitely, could be incorporated, just based off of breast milk and the physiology of that protein transferring. It's safe, but that could absolutely be another area for protein intake.
Both our little guys were tongue-tied and never picked it up post-procedure, again, for breastfeeding. And so we ended up having to formula feed to supplement. Is there a type of formula feeding you recommend? Is there any of this that would change if you end up having to go the formula feeding route? Is there hormones you need to factor in that are a little bit unique? Maybe talk to us a little bit about that.
For sure. So, that's another question that I often get in my office is, formulas. Am I poisoning my baby? Are all formulas equal? And formula is a wonderful option that we have, and it has a very wide spectrum of nutrition. The standards for formula, especially nowadays, is extremely high in quality control. Where there's a difference is sometimes in the processing. So some babies, and it could look different. So some babies may do well with one formula and the next baby doesn't do well. So it can be a bit of like playing around with formulas. I personally, in my practice, promote the European formulas. And that's just because their quality control standards are slightly higher than here in terms of the recommended allowance of certain ingredients. So there are trace amounts of say, for example, aluminum, or trace amounts of other metals in formula, but there also is in breast milk. So, it's impossible to avoid passing that on to baby, but the standards for the levels of like the thresholds are a little bit different in Europe. And I also find infants tolerate it like digestion wise. Some of the European formulas better. Also the goat milk formulas, I find they digest the goat protein better than the early on, generally like less than 6 months, than the cow proteins, which that's just strictly like digestion. They're still learning how to process these proteins, and cows' proteins are different than human proteins. So goat milk, for some reason, for some babies can be digested a little bit better.
Sure. So I'll do one more and then I'll grab a couple, and then I know we got a timekeeper over there who's going to yell at me shortly. So last question on the formula fed process.
Yes.
So naturally there's a difference if mom is breastfeeding and connecting with baby that way. There's also some health changes in the body with breastfeeding. If you're formula feeding, what sort of supplementation or any is necessary to kind of help with that process? Because you're obviously not spending all the time feeding, and like what are the changes that happen to the body then?
Yeah, that's a great question. So essentially there's no difference.
Okay.
If you make a point to have that connection with baby. So like I talked about, that skin on skin with the newborn is crucial to those hormones being released for both baby and mom. So you don't actually need the actual stimulation from the breastfeeding to give those effects. You'll get all the benefits from, holding baby close and looking into baby's eyes. That's another big thing too. They've got a lot of cool studies on brain activity that happens for both mom and baby and dad when you're actually gazing into baby's eyes. So by no means are, baby's formula fed are those hormones impacted negatively. It's still fully attainable.
Amazing. Yeah. Thank you. Okay, any questions from the audience? There's got to be at least one, so I might just pick on someone in a second. Who's looking away the most? Yeah.
There's one.
It's not fully validated, but you just talked about like the beer myth, and then we heard like a Guinness will help with labor. Do you know anything about that?
I mean, you might get a little more relaxed.
That's probably the
I think that's like there's something to like, I mean, the placebo effect too, right? And I'm a firm believer in the placebo effect as well in different areas of practice. But whatever you think is going to help you during that time, I know there's no research on that actual connection, but we know, a little bit of alcohol can relax mom, right? Ease the stress, and that's a big part of transitioning through labor. So I say go for it.
Does dad get a Guinness too?
Dad can have a Guinness too.
Perfect, yeah.
Yes. Is everybody good? All right.
Okay. Well, can we get a big welcoming and thankful hand? Yes. Thank you so much.
Thank you.
Perfect. I wish me and my wife had known some of this. That would have been helpful. We could have stocked our stores with supplements and drugs and made sure we were well prepped. So thank you so much for all that content. And I hope you all take a minute to go accost her at the back and set up your appointments with the mom. Okay, we have another speaker from one of our brand partners. How many here are familiar with Frida? Pretty much, yeah, like pretty much everyone. So when me and my wife had our first one, Frida products were not in Canada. We had no idea any of this existed. So when I started at Snuggle Bugz, this was all net new learning for me. I would describe their products as all of the weird things you would never think of that are incredibly helpful and beneficial and almost must-haves. So I will pass the mic over, and I have so little based on just my ability to talk to these products to add to this. So
Hello. Quick question. Who was here at the first event? Perfect. I can use my same material then. So, Frida Mom, I think a lot of you raised your hand when you talked. We asked if you knew about Frida, right? So, Frida was really developed because there was nothing really out there for mom and parents in a one-stop shop kind of location. Mom was running around the pharmacy looking for, incontinence underwear and pads, and running into all different aisles trying to suit her needs. So Frida Mom was created to fill that space and really provide products for mom. I always recommend 3 top products in the Frida Mom line, no matter which way you give birth. I've had 2 C-sections, and you definitely need these 3 items, no matter which way. So the first, Kate, if you want to grab the Perry bottle. So this is the upside down Perry bottle. What they give you in the hospital is a glorified ketchup bottle. The water comes out in a just straight up gush. It's not great. You have to kind of contort your body to clean the area. Whereas the Frida Mom upside down Perry bottle, it's ergonomically designed that when you're sitting on the toilet, you can just gently squeeze. Thank you, Kate, for saying that. And the flow of water gently cleans the area without you having to contort your body like a circus performer. A lot of people don't realize that even after you've had a C-section, you are passing clots, you are bleeding, and it's really hard to bend and clean yourself when you have a C-section incision. So very important for both ways of giving birth. So what Kate said, just for the microphone, it's a traveling bidet. So it's important to have by your toilet in your hospital bag, ready for the day, the event. So the next item would be the disposable underwear. So again, what they give you at the hospital are these sort of baggy, stretchy, white, see-through, not cute moments. And the Frida Mom underwear are extremely stretchy, which Kate will demonstrate. Yeah, and on the inside, it's actually a really soft material, so it's not irritating on your skin. And they come in 2 different cuts. There's like a boy short cut and a high-waisted bikini option. Both would be fine if you did have a C-section because your incision is so low that they both cover. So I usually say like whatever your personal preference is for underwear. The good thing about them is that they don't rip very easily, as you saw, Kate stretched them. And so you can actually use them through multiple trips to the bathroom or cleaning sessions. And you can just pull out your pad and replace it with a new one. So you don't have to throw them out all the time. Then the third, for whatever way you give birth, is a specific pad for postpartum. So there are different kinds of pads out there. There's pads for incontinence, there's pads for period. A lot of postpartum discharge is going to get pretty intense. But postpartum discharge is a much more viscous discharge. You're passing clots. So if you're dealing with incontinence or periods, it's a much more liquid-based discharge. When you're postpartum passing clots, it doesn't absorb as quickly into a regular pad. The great thing about the Frida Mom pads is that they are built in with a gusset. So a lot of, again, other pads Yeah, kind of like a diaper. There's a gusset, so they're called catch-all pads because they catch the clot rather than if it was just a wing, the clot would be in danger of sliding right off the pad. Another thing is that incontinence pads, sometimes they feel like a pool noodle that you're sitting on because they're so thick. Again, nobody wants that after they've just given birth. So those are the top 3 items in the Frida Mom line that I always recommend to everybody. Now, since today we spoke about breastfeeding and lactation, Frida Mom, actually the 3 newest items in the Frida Mom line in Canada are breast care items, so topical. So the first one will be the hot and cold breast packs. These are great because you can either throw them in the microwave, and heat them up, and which will help lactation and letdown. And then you can also throw them in the freezer, which helps with engorgement and mastitis and any pain that you may be feeling. The design of them, the way they are, you can have them so they're sort of sitting up like this, or you can angle them depending on where any pain points you're having. They're designed so that you can actually pump while you're, relieving the area, or breastfeed during them. The cool thing about these is that there's 2 sides. So one is a bit more of like a fuzzy, plushy side, and the other is more of a knit. Depending on which side you put it on, it would feel warmer or colder depending on what need you had at the moment. They come in a 2-pack, so you can do both at the same time, or just one if you wanted to switch when baby's feeding or you're pumping or what have you. The next item are the hydrogel nipple pads. So these are for relief for cracked nipples, sore nipples. Baby sometimes uses nipples as like a chew toy. So it's not comfortable, especially once those teeth come in. And especially at the start too, you can have cracked, really painful experience in your nipples. So the hydrogel nipple pads are filled with vitamin E for hydration, and they have a cooling sensation that can last up to 4 hours. So what you can do is you can wear them over your nipple, and you can also put them in your bra, and it acts as a barrier so there's no chafing. Another layer you can put on are nursing pads as well, so you don't have any leaking. Kate just put one on her hand. You can come see us after. You can actually feel how nice and cooling it is and how easy it takes off without any residue. And then they come in 2 packs, and there's 4 in a box. The last item, actually, hot off the presses, we just got this item in Canada on Friday. So we have them here, and you guys will be the first people in Canada able to buy them if you wanted to grab a pack today. So what they are, they're individually wrapped all-day dry nursing pads. And you put them in your nursing bra, your regular bra, and they do what you think they do. They soak up any letdown or excess milk that comes out while you're feeding or pumping or just going about your day. Some people maybe don't realize the necessity that this is, and I'm going to tell a personal story. When I first had my daughter, and I was like 3 weeks postpartum, I ran down to get a package from my concierge, and I wasn't wearing my nipple pads, and I was wearing a gray t-shirt, and I was talking to him, and everything was fine. I grabbed my package, and I went back into the elevator, and I had just leaked everywhere down my shirt. So it was really embarrassing. So I definitely recommend picking up a pack of all-day dry nursing pads. The cool thing about the Frida ones is that they have a technology in them that when the milk gets absorbed, it doesn't all just absorb in one spot and stay there in this like heavy pack. It actually disperses the milk across the pad, so it's not in this like one big bulge. They have double-sided tape, so they stick to whatever bra or shirt you're wearing, and they're good for up to 8 hours. So another good thing is sometimes at night, if you don't wear them, you'll wake up to like Lake Erie beside you because you've let down overnight. So it's a really good thing to wear at night as well. So yeah, those are the 3 top Frida Mom items that I recommend, and the 3 breast care items that are available now. So any questions?